This video is based on the Wegovy FlexTouch Pen's instructions for use in the patient information leaflet. For full information, please see the patient information leaflet that comes with your pen. You've been prescribed Wegovy by your healthcare professional based on your individual needs. In adults, Wegovy is a medication used for weight management and for risk reduction of serious heart issues. Hello, I'm Maria, and I'm here to help you learn how to use your Wegovy FlexTouch Pen. It's normal to feel a bit nervous about giving yourself an injection for the first time, so we'll show you how to use your Wegovy FlexTouch Pen. Wegovy comes in a colour-coded pen that you inject yourself with once a week. Each FlexTouch pen contains 4 of your prescribed doses of Wegovy to be used once a week for 4 weeks. Each pack also contains 4 disposable needles, 1 for each injection. Before you inject your first dose, make sure to read the instructions carefully about how to prepare and inject Wegovy in the patient information leaflet included in the pack. You should also talk to your doctor, nurse or pharmacist about how to inject Wegovy correctly and if you have any questions or concerns. Now, let's get started. When you take the pen out of the box, check the name and the dose on the colour-coded label so that you know it's the dose prescribed by your doctor. To start your injection, pull off the pen cap and look through the pen display window at the medicine inside to make sure it's clear and colourless. If it looks cloudy or coloured, do not use the pen. Before each injection with your pen, you'll need to attach a new needle. When you're ready to take your injection, take one of the needles included in the box and tear off the paper tab. Push the needle straight onto the pen, then turn until it's on tight. The needle is covered by 2 caps. Remove the larger outer cap first. Don't throw it away, as you'll need to use it later to remove the needle. Inside, you'll see a smaller inner cap covering the needle. You can remove this. You won't need it again, and you can dispose of it after you're done. Before you use each new pen for the first time, you'll need to make sure it's working properly. To do this, you need to prime your pen. To begin, turn the dose selector from 0 to the flow check symbol shown here. Hold the pen with the needle pointing up, then press and hold the dose button until the dose counter returns to 0. The 0 must line up with the dose pointer. A drop of Wegovy should appear at the tip of the needle. This means it's ready to use. If a drop does not appear, check the flow again. This should only be done twice. If there's still no drop, change the needle and check the flow once more. Do not use the pen if a drop of Wegovy still does not appear. Now you've checked the flow and a drop of Wegovy has appeared, you can dial up your dose and get ready to inject Wegovy. To do this, turn the dose selector to the prescribed dose in the display window. The number in the display window should always match what's written on the pen. Wegovy is given as an injection under the skin. You can inject Wegovy in your upper arm, tummy or upper leg. You can inject in the same area each week, but make sure it's not exactly the same spot as used last time. To inject the dose, line up the pen straight against your injection site so that you can clearly see the display window. Never inject through your clothing. When inserting the needle into your skin, don't cover the dose counter and make sure you can read it clearly. Firmly press and hold down the dose button. The dose counter will return to 0. Continue holding the dose button with the needle in your skin and slowly count to 6. The 0 must line up with the dose pointer. Then slowly lift the pen away from your skin and prepare to dispose of the needle. Always safely dispose of the needle straight after each injection and never use a needle more than once. To remove it, lead the needle into the larger outer needle cap. Once the needle is covered, push the cap completely on, then unscrew the needle and dispose of the needle carefully. Always dispose of the needle straight after each injection. This is to prevent blocked needles, contamination, infection and inaccurate dosing. Put the cap back on until your next dose. You'll use the same pen for all 4 once-weekly injections, but you'll need to attach a new needle each time. When you start on Wegovy, you'll increase your dose every 4 weeks to a different colour-coded pen. This helps you know that you're using the correct dose each time. Your healthcare professional will make this decision based on how you tolerate the dose. Always speak to them. Once you reach the recommended dose of 2.4 milligrams once weekly, do not increase the dose further. Each pack includes 4 of your prescribed doses of Wegovy to be used once a week for 4 weeks. You should keep your unopened pen in the refrigerator between 2 degrees C and 8 degrees C. Keep away from the cooling element. Once opened, keep the pen stored at a temperature below 30 degrees C or in a refrigerator, 2 degrees C to 8 degrees C, away from a cooling element for up to 6 weeks. Do not freeze Wegovy and do not use it if it has been frozen. So that's it. I hope this video has helped you learn more about the Wegovy FlexTouch pen and how to use it. You've got this. This video is based on the Wegovy FlexTouch pen's instructions for use. For full information, please see the patient information leaflet that comes with your pen.